So I mentioned earlier that I'm board certified in anti-aging medicine. It's an interesting specialty and not one that's very frequently found in the alternative medicine world. It's typically a number of previously disgruntled Western medical physicians, internal medicine, OBGYN, endocrinologists, cardiologists, very wide range of Western physicians that are looking for ways to truly improve health and maybe reverse disease and maybe even extend the healthy human lifespan. What I found interesting about anti-aging medicine more than anything is, one, it's very heavily supportive of the alternative medicine and integrative medicine world in identifying safer alternatives for medication, but two, this idea of bioidentical hormone replacement. It is kind of controversial and has been because of a series of studies that were essentially poorly designed when they were created. But what we know now is that bioidentical hormone replacement is a very safe alternative to a lot of the medications that are out there that are used to maybe appease some of the symptoms that we're experiencing. As we get older, our hormone production declines, whether that be growth hormone, testosterone, estrogen, progesterone, what have you. It declines and it changes. So as an anti-aging physician, we look to identify ways to improve that hormone profile and essentially regulate the hormone production or the hormone intake, if you will, to give you the feelings that you've had of your youth. Hormones really control so much of how we feel and think and act. And if we can identify the proper blend of hormones and the cascade of hormones production at various times throughout the day, let alone various times throughout the month, we will have very significant health benefits. So Dr. Josie and I together, we review labs, we identify deficiencies, we identify excesses, and we identify imbalances, and we regulate those through bioidentical hormone replacement, nutrient supplementation, and herbal medicine, and sometimes diet and lifestyle depending on the patient. But bioidentical hormone replacement, I can tell you, is definitely here to stay and is not just medicine of the future, but it really is going to change the way most, I think, internal medicine endocrinologists practice in the future. People are looking for results, and they're looking for pretty close to immediate changes in the way they feel. We can't just kind of dabble in this kind of medicine. It's a new specialty. In terms of the public, it's a new specialty. I've been part of the American Academy of Anti-Aging Medicine for, I think, since 2003, and it's now really just coming into its forefront. Tens of thousands of physician members throughout the world and are involved in this movement, and it is incredibly beneficial to not just seeing the numbers on your lab report look better, but actually feeling better and living a more active, healthy, vital life.